Hey guys, Leon here, and today in this video we're going to be looking at the hair transplant. We're going to be looking at who's a good candidate for one and what the kind of timelines are that you can expect if you do go through with the procedure. Now, if you're thinking of getting a hair transplant or you may have already had one, then this video is perfect for you, so make sure to stay tuned. So guys, if you're worried about your own hair loss, what you can do is you can click the link in the description, you can upload a hair selfie, answer a few short questions, and then you'll get your free Hairguard analysis. So let's get into the video. What is a hair transplant? A hair transplant is a popular surgical replacement procedure where hair units are removed from a donor site, which is usually the back of the scalp, and they're transplanted into the recipient site. In 2014 alone, almost 400,000 people worldwide underwent hair transplant surgery. So who is the best candidate for a hair transplant? So first is men with male pattern baldness classified at Norwood 3 or above. And as you can see on the right there, we've got the Norwood scale. Now, male pattern baldness is the most common cause of balding in men, and it's the one that takes place in stages. The most advanced thinning and hairline recession begins to take place at stage 3, and this is also when a more predictable pattern of loss emerges. While stages prior to Norwood 3 are bothersome, most surgeons will not treat so early. This is because there are many non-invasive treatments that can be more effective for earlier hair loss, including Rogaine and Propecia. Next, we're going to have a look at men with a stable loss pattern. Now, even if you are a male with NW3 hair loss, a reputable surgeon may be wary of performing the procedure if your hairline is continuing to recede. The recession of your hairline happens as a result of sensitivity to dihydrotestosterone. This occurs in men with androgenetic alopecia and can lead to full baldness if not treated. If you haven't begun to treat the DHT sensitivity, whether through natural or medicated means, the recession will continue. It will continue even after a hair transplant takes place. And then we've got men and women with trauma-related hair loss. Now, if you've experienced hair loss as a result of injury, surgery or burns, a hair restoration surgeon may be able to work with you to restore your hair. In such cases, hair loss like this is stable enough to see good results with a transplant. In addition to the above, your surgeon may also prefer that you've tried other treatment methods before moving forward with the procedure. Now, what can you expect immediately following a hair transplant surgery? The first thing that you can expect is a donor and recipient site pain and discomfort. As with any surgical procedure, it's very common to experience pain and discomfort for the first few days following a transplant. The pain is typically minor and localized to the sites of the transplant. Assuming a smooth healing process, the pain should subside within a few days. Discomfort may continue, but a scalp massage can help to quicken healing and lessen discomfort. You can also expect some donor and recipient site bleeding. As incisions have been made into your scalp, bleeding at the site of transplant are very common. You can expect bleeding to continue sporadically for about 2 weeks, though it should only be minor and not continuous. Your surgeon should tell you how they prefer you handle the bleeding, though it's common practice to apply gentle pressure with a moistened clean cloth for 5 to 10 minutes. If your bleeding continues after pressure has been applied, or if the amounts seem excessive, call your surgeon. And the third thing is scalp and face swelling. Swelling of the scalp is expected following a transplant. However, you may not be aware that facial swelling can happen too. Swelling, also known as edema, can occur on the forehead, under the eyes, and above the bridge of the nose. In most cases, it is minor. To lessen the swelling you experience, there are a few things you can do, including elevating your head while you sleep, applying an ice pack to the area of facial swelling, massaging the area of facial swelling, avoiding excess physical activity. If the swelling is interfering with your daily life, consult with your surgeon. In extreme cases, your surgeon may prescribe a low-dose steroid to keep the swelling at a minimum. Also, you can expect graft, scabbing, and dryness. Once the bleeding has mostly stopped and the swelling has reduced, it's normal to experience crusting of the individual implant grafts. The crusts are commonly removed with a combination of gentle massage and a damp cloth, though your surgeon will provide you with detailed instructions. The most important thing is not to pick the scabs, as this can damage the grafts and even dislodge them. Now we're going to look at how to minimize post-transplant side effects. To keep the above effects to a minimum, there are a few things you should be mindful of. First, avoid exercise for at least 3 days following the procedure. Becoming too active too quickly can worsen the bleeding, increase swelling and discomfort, and it may even dislodge the grafts. Second, follow your doctor's post-procedure instructions to the letter. This means completing any course of antibiotics or steroids as prescribed and caring for the sites of transplant as outlined. Third, avoid styling or use of non-necessary products for a few weeks post-transplant. The addition of chemicals to your scalp, as well as the irritation that styling causes, can mean a poor outcome for your transplant. Fourth, visit your doctor for the post-procedure follow-up as scheduled. Many patients don't realise that this appointment is crucial for the longevity of your transplant. This is because doctors can detect signs of an issue before it progresses. Now we're going to look at post-healing, so we're going to give you a timeline of what to expect. In months 4 to 8, you're going to be looking at the emergent period. Now, the moment you've been waiting for has finally arrived and hair is growing in the recipient area. At this point in the process, your transplanted follicles have moved from the telogen phase into anagen. This phase of the hair growth cycle is when active growth takes place. In the beginning, these hairs will be especially thin. If you've received a transplant to the crown of your head, expect growth to take longer as the skin is thicker. You'll also likely return to your surgeon somewhere within this time frame for a follow-up appointment. In regards to the donor site, it should be fully healed by now. This means the hair growth cycle has returned to normal and no evidence of the transplant is visible. And the final stage in the first year process following a transplant is known as the maturation period. This is the time when the thin hairs become thicker and the majority of hair growth should be seen. During this period, you may notice that newly sprouted hairs are curved. This is due to the scarring, but it will disappear over time as your hair follicles heal more fully. At this stage, your hair should be about 3 inches in length and be able to be styled. And in months 12 and beyond, just as above, the results you see in the second year following a transplant will vary. By 24 months, the full results should be visible, and this is the point when it comes to consider if another transplant session is necessary. As your transplanted hair should now be fully into the natural hair growth cycle, you should expect a period of overall growth for up to 3 years. This is the typical length of the anagen phase, after which the hair will go through the other 2 stages, which are catagen and telogen. Now, what can you do if you didn't receive the results that you were looking for? For many men and women, a transplant can provide them with results they can be proud of. However, there are instances where the procedure doesn't meet expectations. So you can undergo another transplant session, you could consider other restoration options, or you could just start to treat the underlying cause. Now, even individuals who are happy with the initial results of their transplants may find themselves feeling discouraged again in 5 to 10 years' time. Why? Because if you don't treat the underlying cause of hair loss, the symptoms will just continue. Of course, treating the underlying cause isn't always simple. In fact, it can be the most daunting part of the entire process. However, the work you put in will be worth it in the end. We personally recommend natural methods of treatment as these do more than cover up the issue. With natural treatments, you can attack the cause of alopecia from within and bring it to an end. In severe cases, this may not restore your hair, however, it can prevent further loss from occurring. Some of the most recommended treatment methods include changing the diet, the use of oils, extracts and herbs, and microneedling. However, there are dozens of all natural treatments you can choose from. If you are considering undergoing a hair transplant, it's a good idea to know what to expect before undergoing the procedure. One thing to know is the timeline of growth and what you can expect in terms of results. We strongly suggest against hair transplants, but that doesn't mean they aren't the right choice for you. However, we do recommend you do thorough research and even try a few natural methods of hair loss treatment. So guys, that's what we wanted to share with you today on the hair transplant. Again, if you're worried about your own hair loss, you can click the link in the description and get your Hairguard analysis. Don't forget to hit subscribe, and I'll see you in the next video.